With Frank here, we'll do the layers as well. So the superficial layer is the trapezius and the latissimus dorsi. So trapezius attaches from the back of the head, moving downward along the spine, and then it fans out to attach to the collarbone, the shoulder blade, and the inside of the shoulder blade as well. The latissimus dorsi starts its attachment in this level here, moving all the way down, blending in with the thoracolumbar fascia and attaching to the back of the hip. Then it fans out, attaches to the ribs, and then moving upward and outward to attach to the arm. The other layer is the rhomboids just underneath the trapezius. It along with the trapezius, attaches to the shoulder blade here, and both the trapezius and the rhomboids help bring the shoulder back. The other actions of the trapezius is bringing the shoulder up as well. Once you remove that layer, you have the muscles of serratus posterior superior and inferior here that are respiratory muscles. So the upper one, the superior one, helps with inhalation, breathing in. The lower one helps with exhalation, breathing out. It also attaches here, the serratus posterior inferior. So you can see the lats, this muscle, serratus posterior inferior, that will be the sticking area that I've been talking about. Once we remove those layers, you're with the erector spinae that attach along either side of the spine, blend in with the thoracolumbar fascia to attach to the back of the hip. One of the muscles continues upward to attach to this bone over here, which is basically lower and back of the ear. Once you remove those muscles, you're into the multifidus muscles. And the multifidus rotatories are in the groove here of each vertebrae. Multifidus runs basically from the neck all the way down to the back of the hip. Rotatories, which is the deepest muscle, attaches along inside the spine here. I shouldn't say inside, but more in the groove itself. So you have rotatories, multifidus, and then the inner part of the erector spinae. We'll use a lacrosse ball to get into that lamina groove to help decrease any adhesions and tightness with those muscles. The other muscle that we like to talk about is quadratus lumborum. Quadratus lumborum attaches to the bottom rib here. It also attaches to the spine and to the hip. So this muscle can have large amounts of trigger points if left untreated. And so we need to use some specific work in order to reduce the tone and trigger points in that area there. When I move Frank sideways, here is quadratus lumborum. Behind QL is the erector spinae. So it's one of the deepest muscles in the back. In front of it will be the psoas muscle, which is the major hip flexor. So you can see that there's really a very close connection between the hip flexor and the back extensor. So QL helps extend the back, as well as it side bends the body. I should turn Frank around. Side bends the body this way, and it also brings up the hip, so hip hike. So those are the muscles that we're going to address with massage techniques.